Discussion question. A 35-year-old with chronic back pain and anxiety asks about a medical cannabis card. He has tried ibuprofen and physical therapy. Based on this review, how would you respond? Thank you for asking about this. It's very common for people with persistent back pain and anxiety to wonder if medical cannabis might help. I want to give you an honest, evidence-based answer based on a major 2025 review of all the research. For chronic back pain like yours, the current guidelines from the American College of Physicians and other expert groups recommend against using cannabis or cannabinoids as a first-line treatment. The evidence shows that any benefit is small, and the risks, especially from inhaled products, smoking, vaping, are significant. In fact, daily inhaled cannabis increases the risk of heart attack and stroke, even in people without prior heart disease. For anxiety, the story is similar. High-potency cannabis, which is what most dispensaries sell, actually increases the risk of anxiety symptoms. 19% of people using high-potency products develop anxiety, compared to 12% using low-potency products. There is very preliminary data on CBD for anxiety, but the studies are too small and short-term to recommend it. The American Psychiatric Association strongly advises against using cannabis for any psychiatric condition because it can make anxiety and depression worse. There's also a real risk of developing cannabis use disorder. The review found that 29% of people who use cannabis for medical reasons end up meeting criteria for addiction. So, based on the evidence, I cannot recommend a medical cannabis card for your back pain or anxiety. Instead, I'd like to discuss other treatments that have strong evidence. For your back pain, other non-opioid options like NSAIDs, if tolerated, muscle relaxants, nerve pain medications, gabapentin or duloxetine, and referral to physical therapy or pain psychology. For your anxiety, cognitive behavioral therapy, CBT, is very effective, and there are several FDA-approved medications, SSRIs, SNRIs, that are safe and well-studied. If, after trying these, you still want to consider cannabis, I will work with you on harm reduction, but I cannot certify you for a medical card because the evidence does not support it for your conditions. What should not say, and keep important boundaries. Does not say cannabis is completely useless. It acknowledges small effects in some studies, but those do not outweigh risks or meet guideline thresholds. Does not say you can never try it. It leaves room for patient autonomy while clearly stating medical advice. Does not say, I will certify your card. The review explicitly states that most state-approved qualifying conditions are not evidence-based. But what if the patient pushes back? Patient, but my friend got a card for his back pain and says it helps. I understand. Some people do report feeling better, but controlled studies show that the effect is small and often no better than placebo. Meanwhile, we know the risks are real, including heart problems, addiction, and worsening anxiety. I want to help you find something that works without those risks. Let's try the proven options first. If they don't work, we can revisit the conversation, but I still wouldn't recommend cannabis as a primary treatment. What about just CBD, not THC? That's not psychoactive. Good question. The review found that for anxiety, the CBD studies are very small and short-term, not enough to recommend. For pain, there's even less evidence. Also, over-the-counter CBD products are not FDA regulated. Many are mislabeled or contaminated with heavy metals or THC. If you want to try CBD despite this, I recommend a pharmaceutical-grade product, if available, and starting with a very low dose. But I still think we should focus on treatments with stronger evidence first.